Hello everyone, welcome to Tech Sharmit. In this session, we will discuss about the RCM. RCM is most important, or you can say most popular term for healthcare industry. The full form of RCM is Revenue Cycle Management. So far, what we have learned about all the basic things related to medical coding. Like we discuss about the medical coding process, we discuss about the role of medical coding, importance of coding and coders, as well as we have covered few terminologies like inpatient and outpatient services. These all things that we have covered so far, right? Now we will discuss about RCM. The reason to discuss this RCM later is because I want to firstly clear all the basic things, so that when you are learning this RCM, or you can say revenue cycle management, then it would be much easier for you to understand the terms that I'm using for explaining this RCM cycle. Okay, so let's see what all we have written here for RCM. We will start with a basic discussion first. So RCM stands for Revenue Cycle Management. Now, what is the exact definition or appropriate definition for revenue cycle management? So, revenue cycle management refers to the process of managing financial aspects of patient's encounter with healthcare provider. Okay, from initial appointment or encounter through the final payment of the balance. So this entire cycle, let's say, just assume there is one patient who is facing some issues, medical issues. So what he will do, he will reach out to the healthcare provider, and then all the process is being conducted in order to treat the disease of the patient. So from the initial appointment through the final balance, final payment of the balance, this entire cycle is known as revenue cycle management. Means this process will cover all the aspects of all the financial aspects for the patient encounter with the healthcare provider. So this is the best definition for revenue cycle management. Now there might be one question. We know that this is the cycle. This cycle is known as revenue cycle management. But what is the goal? Why we are using this? So here I have mentioned the goal of RCM is to optimize the revenue generated by healthcare services while ensuring accurate and timely reimbursement. Okay, so overall goal for RCM is that to generate the to optimize the revenue generated by the healthcare services. Okay, so this is the whole sole goal. We have to optimize the revenue, and that optimized revenue will somewhere benefit the healthcare industry for sure, because we are taking care of all the financial aspects here in the RCM process. So it will help for it is it would be very impactful for the healthcare industry outcomes. Okay, so we know what is RCM. Now we are aware of goal as well. Now what are the key components of revenue cycle management in medical coding? So before we discuss these points, let me clear one thing. It might be you might feel like when you refer any other book or any other topics, then you will see that there some people are merging these points. So that's why maybe there you will find only 5 to 6 phases or 5 to 6 components only. Some are elaborating all these points into multiple points, so they you might find more than 9 points there. Okay, so it is totally dependent on the purpose or on the need, like how you are elaborating this point. But in our case, what we will discuss these 9 points, and these 9 points will cover all the things related to the revenue cycle management in medical coding. Okay, so these are the very important key components for revenue cycle management. Okay, so let's start one by one. So first point is patient registration and scheduling. Second point is insurance verification. Then we will go for charge capture. Then claim submission is processed. After that, claim adjudication is processed. Then payment posting is completed. And then comes denial management. Post denial management, patient billing and collection occur. And after that, at last, we will prepare the financial reporting. Okay, so these all are the key component for the revenue cycle management of medical coding. Now what we will do, we will discuss each of these point in detail. So let's move to the next slide. First point is patient registration and scheduling. The process begins with capturing accurate patient information during registration and scheduling appointment. Okay, so just assume there is one patient who is visiting a healthcare provider. So the first process would be conducted. The registration is the process that would be conducted. So during registration, every required or accurate patient information is gathered and then perform the appointment scheduling. This includes demographic detail, insurance information, and other relevant data. Let's say some personal information as well. So first step covers the process of capturing information or accurate information for the from the patient during the registration process. So this is the first point. Then comes insurance verification. Now, what is verification? The term verification is to verify something whether it is completed properly or not. So this thing comes under insurance verification. So RCM involves verifying patient insurance coverage to ensure that the healthcare provider will be reimbursed for the services provided. So this step ensure that all the coverage uh, uh, that healthcare provider is providing will be reimbursement for the services provided. Okay, this step helps in avoiding claim denial due to coverage issue. So all such type of denials like claim denials or maybe any other blockers will be resolved in this insurance verification, and it is also used to avoid the fraudulent. Okay, because now the person is aware what all service he has received and for what all things he is reimbursed. Okay, so this is the second point where we are verifying patient insurance coverage just to make sure that healthcare provider will be reimbursed for the services he has provided only. Then third point is charge capture. What comes here? Medical coders assign appropriate code to the service and procedure performed during the patient visit. So this thing we have already covered, right? That's why I covered the basic things before, because now we have idea who is medical coder, what how the code is assigned. Okay, so medical coders assign appropriate codes to the services and procedure performed during the patient visit. Accurate coding is crucial for proper reimbursement and compliance with the guidelines. So we know that coding plays a vital role for the reimbursement process. So during this phase, during this component, what all things will be performed? Firstly, medical coder assign the appropriate code to the services and procedures performed during the process patient visit. Then, like all the reimbursement process is further processed. After that, we come to the point claim submission. Once the services are coded, claims are submitted to insurance company for reimbursement, because this is a crucial step, right? Because you have provided all the services, now it's time to process the reimbursement, because this is the whole sole target of this cycle. We have to uh, provide a proper claim submission, right? So timely and accurate submission is essential to avoid delay in payment, because if you are not claiming the submission, then it would be time taking for the other department to process the payment. So that's why timely and accurate submission is the essential to avoid delays in payment. Then it comes the claim adjudication. Insurance company review the claim for accuracy and compliance with their policies. The process may involve check for medical necessity, coding accuracy, and adherence to the contractual agreements. So yes, in some cases, two parties mutually agreed on some agreement, and then it is the necessity to check those whether it is whether those contractual agreement is fulfilled or not. Okay, so claim adjudication process covers all this thing like this process involves checks of medical necessity, coding accuracy, and adherence to the contractual agreements. So these are the 5 points that considered as a equipment, or you can say not the equipment, the components of the revenue cycle management. Then we have payment posting. After a claim is adjudicated, the payment receives from the insurance company is recorded. Any discrepancies or issues with the payment are addressed during this phase. Okay, so if there is any issues, then appropriate action has been taken here. Okay, then we have another point which is denial management, and this is very important point because in case of any kind of denial, let's say in case where a claim is denied, RCM include the process of identifying the reason for denial and taking appropriate action to resubmit the claim or to appeal the decision. Okay, there might be some situation where the claim is denied. So what RCM will do, it will identify the reason first, because reason is very necessary point before claiming or for appealing the decision. So firstly they identify, RCM process identify the denial reason, and then appropriate action has been taken, either the resubmission of the claim or the or for appealing the decision. Okay, then comes the patient billing and collection. Once insurance payment are received, the remaining balance is billed to the patient. RCM include managing patient billing, sending statement, and pursuing collections when necessary. So these all process comes under this patient billing and collection. And at last we generate the financial report for improving the system. So you can see RCM involves generating reports to analyze the financial performance of the healthcare facility. This may include key performance indicator, account receivable aging report, and metric to monitor revenue and identify the areas of improvement. Because if you remember at the time of definition we mentioned this thing, financial aspects, managing the financial aspects. So it is always recommended to verify that all the things have been covered properly, all the processes conducted properly, and if during the monitoring, if any issue or any areas are found for the improvement, then that is processed for further steps, maybe like for the further cycle of the RCM. Team makes sure that everything, if if there is any rectification is required, then that rectification is performed. Okay, so yeah, these are all the points which is considered as a key component of revenue cycle management. I hope these points are clear to all of you. In the next session we will discuss few more things. So thank you for watching Tech Sharmit.